Hi everyone, I'm Dr. Joseph Gnanaraj. This is Dr. Logic 360, where your health gets smarter and simpler. The shocking statistics is that 48% of the US adult population has this silent killer, which is hypertension. They call it the silent killer for a reason. It's like a ninja in a stealth movie. It sneaks in, makes zero noise, and does the damage before you even know it's there. You know, humans are funny. When our phone battery drops below 20%, we panic. But most humans, when their blood pressure hits 160, they act like movie heroes who just walked away from an explosion. I'm fine, just a little dizziness. I will just drink some water and walk it off. No, my friend, you cannot walk off a high blood pressure. That's not bravery, that's denial. Today, we are diving into the brand new 2025 clinical guidelines. We are also going to see what are the consequences of elevated blood pressures and when do you need medications. We are going to break it all down. Stay tuned. Hypertension is the head office for almost every major health problem. It could affect the heart, leading to heart failure, heart attacks. It could also lead to strokes and brain bleeds. Hypertension is one of the important causes of kidney failure. Uncontrolled hypertension can lead to cognitive impairment and dementia. Uncontrolled hypertension can lead to formation of aneurysms, which means dilation of the blood vessels. So, before we get to the new rules, let's see what the numbers mean. Doctors always give you two numbers, right? Like 120 over 80. What does that actually mean? Let's use a bicycle pump analogy. You know how a manual bike pump works, right? When you push the handle down to force air into the tire, that creates maximum pressure. That is your systolic pressure, the top number. That is your heart squeezing. When you pull the handle up to refill the pump with air, there is still some pressure in the tube, right? That's the pressure in the arteries. That's called diastolic pressure. That is your heart relaxing between beats. Both numbers matter. Don't think the top number is the main character and the bottom number is just the sidekick. No, no. If either one is too high, the tire could pop. We need both Batman and Robin to be in check. So, what should your dashboard read in 2025? Let's look at the new guidelines. In the old days, if you were at 140 over 90, people would say, hey, it's just stress, you're fine. Not anymore. The 2025 guidelines have tightened the rules. So, normal blood pressure goal is 120 over 80. This is the A plus student. You get a gold star. Elevated blood pressure is between 120 and 129. This is the watch zone. You are being watched. And stage 1 hypertension is 130 to 139, or when the lower number is between 80 and 89. We need some work to do here. Stage 2 hypertension is when your blood pressure is 140 over 90 or higher. This is the treatment territory for sure. Even though the goal is below 130 over 80, it's preferred to be lower than 120 over 80. So now listen closely. Some of you are doing everything right. You eat like a rabbit, you run marathons, you meditate, but your BP is still 160. This could be secondary hypertension, which means your blood pressure goes up because of some other disease. It could be diseases such as a blockage in the arteries supplying your kidneys, or when your adrenal gland has a nodule or it enlarges and secrete a hormone called aldosterone, which could increase your blood pressure. The doctors can detect this condition by doing blood test for aldosterone levels. So what are the causes of high blood pressures? Genetics, thanks. Mom and dad, the family inheritance nobody wants. Second, as you age, your artery stiffens and your blood pressure may also raise. Third, alcohol consumption can lead to elevated blood pressures. 4. Smoking. Smoking can increase your blood pressure. 5. Physical inactivity and lack of exercise. 6. Obesity can increase your blood pressures. 7. Sleep apnea also can elevate your blood pressure and is one of the important reasons for elevated blood pressures. Above all these 7 causes, the most important is the salt. Salt is the main villain. Excess salt intake can increase your blood pressure considerably. The next question is, can we lower blood pressure without pills? Yes, but you have to put in the work. So, by adapting to special diets such as DASH diet, which is the acronym for dietary approach to stop hypertension, can considerably decrease your blood pressure. The DASH diet is nothing but it's predominantly fruits, veggies, and nuts. It does not stand for dash to the fridge for a midnight snack. I know kale isn't as exciting as cheeseburger, but your arteries prefer the kale. Then, salt substitutes. The guidelines now strongly suggest using potassium enriched salt substitutes. It tastes like salt, looks like salt, but it could actually lower your blood pressure. However, if you have kidney disease, do not touch this without asking your doctor. For you, potassium can be kryptonite. Then, weight loss. By losing 1 kilogram, you could reduce your blood pressure by 1 millimeter of mercury. So, weight loss helps a lot in reducing your blood pressure. Number 4, exercise. Walking every day for 30 minutes, at least 5 times a week, also reduces your blood pressure. 5. Sleeping adequately for 7 to 8 hours can reduce the risk of elevated blood pressures. And then treatment of sleep apnea could improve your blood pressure control too. Sometimes lifestyle is not enough, and that's okay. That is what modern medicine is for. If your blood pressure is more than 140 over 90, you need medications immediately. So please call your doctor. Or if you have diabetes or a history of stroke or heart attacks or kidney disease, we prefer the blood pressure to be less than 130 over 80. If you have any of these conditions, your doctor will prescribe a medication if your blood pressure is more than 130 over 80. Please do not stop taking your meds because you read a blog post by Herbal Healer 99 on the internet. Consult your doctor for medications and before taking your supplements. Dr. Google has a terrible track record. You type in headache and Dr. Google tells you you have 3 minutes to live. Usually, doctors will give you 2 low-dose medications combined in one pill. It works faster and better, like the Avengers assembling to fight the bad guys. So, here's the bottom line. Blood pressure isn't just a number. It's the scorecard for your longevity. Check it today. Under 120 over 80, high five, you're winning.